I'm Dr. Michael DeTola.
And I'm Megan Strong.
In this week's Case of the Week, we'll find out that 2 separate full arch impressions might be better than a full arch double arch impression.
And is your hygienist crabby? If you're a wimp, try the shrimp.
Am I just being super annoying, or did I just go 3 songs forward to my MP3 player? Don't ask Megan, she'll say annoying. That and more on today's Chairside Live. Hey now, hello and welcome to episode 72 of Chairside Live. Despite the government shutdown, we press on. Thankfully, we're not sponsored by the government in any way, shape, or form. Private enterprise drives this engine, so the show marches on. Megan, how are you?
I'm doing well, sort of well. What happened last night is I was cutting some squash, and, I may or may not have sliced through my entire thumb, and then I cleaned it, and then I, super glued it. But that doesn't hold a candle to the real story of today, because it's your birthday!
Oh, yes it is. Yes. Thank you so much.
Look how cute that is.
That is a very cute candle.
It is.
I'm hoping this is one of the trick ones.
Nope. Did you make a wish?
No, I didn't.
Why
yes,
not?
I did. I want a red bag. There it is.
Okay, well, your wish is
perfect.
My
Look at
command.
That.
We have a present for you from the whole crew.
Thank you. I'm glad it wasn't one of those trick candles. You know, the funny thing about those trick candles is usually you use them like on kids, where you blow it out.
Right.
Or maybe old people. Mm-hmm. And so they blow on it, and it comes back on. They blow on it again, and they do it 6 or 7 times. But who's the joke on? You know, the kids are spitting on that cake, 7 or 8 times. And
totally.
You're the one eating the saliva-laden
yes.
cake, pastry at that point.
Mm-hmm.
Shall I open this now or
you
save
shall,
it for later?
Please.
Are there multiple things?
Yes, and there's a card too, but you can start off with that.
Perfect. Oh, catnip bubbles.
Catnip bubbles!
Wow.
Tell me about that.
If you may or may not know, I'm part feline, and she knows this. Hold on a minute. Because I am feeling... Ooh, my tail's vibrating. We've got a firefly flashing mat, more cat toys.
Yeah, here's the card.
I've got... I'll show that later. A cheese chaser,
yes.
Much like a chubby chaser, except that is also for the cat. And lastly, the Star Wars Pet Fans collection. It's got to be some little chase toys.
Isn't that what you've always wanted?
That's amazing.
Yes.
For those of the viewers at home, I apologize for this personal indulgence, but we've got a new cat at home, and it's kind of taken over our lives, including having to learn what anal glands are last night at about 11 o'clock at night to figure out what the hell was happening.
Gross.
So anyway, thank you so
Happy
much.
Birthday.
Thank you very much.
Yes.
Appreciate that. We've got an interesting case of the week for you today. It's a double arch impression, but it's a full mouth double arch impression. So usually we say, don't use double arch impressions for 4-unit bridges. And this is a prescription for a 4-unit Bruxer bridge. And the doctor did use a double arch tray, but it's a full mouth double arch tray, so that probably gets away from some of that. But there are some complications with that tray and this case. In fact, let's take a look at that now. I stopped by to say hi to my favorite technical support phone person the other day, and she had this case sitting on her desk. And, these full arch, double arch trays I find very interesting. I like the idea, in a sense, of being able to do upper and lower, have the patient bite together all at the same time. But the difficult thing about these is when the patient bites into it, it's hard to verify whether or not they're biting all the way together. And as I hold this one up to the light, I can see just spots, like pinpoint spots over there where we can see things maybe contacting, but maybe not. That actually just looks like shininess on the impression material. As I hold it up to the light, which you won't be able to see, I can tell you that the only place I really see contact is on the anterior teeth, on those lower anteriors. There you can kind of see it there on the incisal edges. But I don't see any other contact anywhere else, and so we have this prep for a bridge over here, for a Bruxer bridge. But on this other side, we should be able to see these unprepared teeth that are opposing these unprepared teeth contacting, and we don't. So there was no bite registration sent along with this case, so the bite could most definitely be off here. And that's one of the questions that we actually have about this case. The solid model looks a little like this. We've got a 4-unit Bruxer bridge. It appears to be a recent extraction here of the first bicuspid. So we have a cuspid, a second bi, and a first molar. Not a lot there. It looks like a lot of reduction there. Cuspid looks like it Probably may have been a virgin tooth or a close to a virgin tooth. And that's kind of an indistinct margin that disappears right at the stone. And that looks a lot like my models looked for the first 13 years of my career. And usually what the impression looks like on something like that is that the end of the impression is also the margin. So for example, what I mean is, this is the end of the impression right here, this little tag right here. And when that's also the margin, when they coincidentally are on the same line, that to me today would represent an inadequate impression. I need to see some impression material beyond the margin. I need to see something past it so I can positively identify that margin. Not only so I can positively identify it, but as long as we have impression material beyond the margin, when it comes time for the technician to look at the stone model, they're going to be able to see that extra impression material as a space on the model, and it's simply a matter of flicking it away to expose this margin. But I used to take impressions like this day in and day out. My assistant would hand it to me and say, how does it look? Did you get the margin? I say, yep, there it is right there. Not knowing, because I hadn't spent any time in a laboratory yet, that unless you have material beyond the margin, you won't be able to positively identify this. I've spent so much time with technicians in my operatory and spend time watching them work that I'd like to see every student accepted into dental school have to spend a 6-month internship in a dental laboratory before they go to school. In fact, I just hired a dentist who had been a ceramist for 14 years, and her preps are gorgeous because when you get somebody prepping teeth who used to have to deal with under reduction, they do not under reduce. They get things right. I'm not sure you could build a better dentist than somebody who had been a technician for 14 years. So we kind of have some indistinct margins on the other ones too. If we zoom in a little bit, we're going to see that it's really kind of difficult to see separation between the stone model and that. You can see certain areas, like for example, right along in here, there's some separation between there. Not much, but a little bit of separation. But that's what we get when we have that little extra piece of impression material sticking down there. It gives us the ability to see that margin. Now, obviously, it's a very, very feather edge margin. That'll work for Bruxer. Again, this 4-unit Bruxer bridge with just that one Pontic. Nothing wrong with that choice. You've heard me say before, though, that PFM bridges fracture less than Bruxer bridges do. And those really are our only two choices. We can't go with Emax, and I'm not a huge fan of porcelain fused to zirconia frameworks because I've seen too many of those fractures. So in a case like this, I might go with PFM. It would all depend on the rest of the aesthetics of the patient. I'm not sure that, unless they're getting ready to start doing some aesthetic work over here, it might be okay with the PFM. So I think this Bruxer bridge will do fine as long as there's enough reduction. And so let's take a look at that reduction, and we'll have the patient close. And you can see, remember where I said the only point of contact when I held the impression up to the light was on the incisal edges of the lower anterior. So you can see that there as it hits. And actually there appears to be a slide here as we push those models together. And this actually is a good representation of the impression because remember, we didn't see any contact between the teeth over on the other side in the impression. You can see that the bite is in fact open over there. If we go to the prep side, now I'm questioning this a little bit too because that tooth could be super erupted like that and be behind that one since it doesn't have its opposing partner. And this is why the case had been pulled, was for not enough room on this tooth right here. And so we can see that tooth number 13 does in fact not have enough room to do a Bruxer bridge there. Again, that's less than half a millimeter. And so this is another situation where a depth cutting burr would have gone a long way to making sure that that did not happen. So those two teeth looked really short when we looked at the solid model and the preps, like there wasn't a lot of clinical crown left. But number 13 still has not been reduced enough in spots, whereas 14 has been reduced plenty for that bridge. And we'd probably want to get rid of this sharp line angle right here on the cuspid, that sharp little point on the preparation. And that's because when we're milling materials like Bruxer or Emax, the burrs that we have are typically wider than a very sharp point like that. So to make sure the crown will fit, the milling unit has to over mill it and has to come all the way up and a little bit past it and then go back and forth to round out an area big enough so that sharp point can fit in there. And you end up with a crown that ends up being thinner than it needs to be and sometimes getting show through of a discolored tooth underneath it because we've made the restoration thinner. So that's why with CAD-CAM we don't like to have any sharp points like this. Everything should be rounded so that the burr can mill as truly as possible without having to overcompensate for something like that. So because of this, not knowing if the bite is correct or not, based on that impression, we're going to have to call the doctor and see what he wants to do. Even though we have a no-fault remake policy, this would probably be one where if I was on the phone and the doctor said go for it, I said we'll go for it, but the no-fault remake policy probably doesn't apply here because I don't think that bite is correct based on the impression. But if he wants to go for it, we will go for it and make that bridge and see how it all turns out.
Thank you for that, Birthday Datola.
You're welcome, Clumsy Strong.
Now let's go to a segment we call Viewer Mail. This letter comes to us from Dr. John Falbo from Charleston, West Virginia, and he writes, Dear Dr. Datola, happy birthday. No, he didn't actually write that, but I just threw that in there for fun. He says, I recently inherited a case in which veneers needed to be redone. It looks as though a good bit of enamel has been ground away. Is there a predictable way to bond veneers to dentin, or should these teeth be crowned? Thank you.
Wow, John, that is a difficult question. And on my birthday, I was hoping not to do so much heavy lifting. This is actually, it's a little tough to say, without seeing the picture. And we could probably have a 30-minute conversation on the phone, kind of going back and forth and discussing the pros and cons. Let me start by saying I don't think that there's necessarily any right answer here. I think if you put a new set of veneers on, that could be appropriate. And if you did put crowns on, that would be appropriate as well. My first question would be, you've got some veneers that need to be replaced. Did any of them fall off? Because if, in fact, they are bonded to deep dentin, as you seem to suggest, if they have stayed in place, say, for 7 or 8 years, it would seem as though you would be able to bond some new veneers into place. Maybe the veneers broke, and that's why they're being replaced. I'm not sure. Depending on when they were placed, it was probably a pressed ceramic or a feldspathic ceramic or a lucite reinforced ceramic, all of which have a flexural strength of about 110 megapascals. And so I would do what most of the dentists here at Glidewell are doing, and that is to use Emax for veneers if, in fact, you're going to go ahead and do veneers. Now, the deeper you go into the tooth, into the dentin, it does become more difficult to bond to as opposed to, say, a minimal prep veneer where you're just bonding to enamel. So that is one issue, the bond strength, whether or not the patient had any postoperative sensitivity, whether or not you're going to have to do much prepping on the tooth to get the old resin cement off once the veneers come off. But you could certainly make a decent argument for doing crowns on the teeth as well, especially if they broke contacts on all the preparation. So if they've reduced a millimeter and a quarter or a half on the facial surface of those teeth to get down into the dentin, then they also broke contacts in between all those teeth, really, and wrapped the incisal edge maybe as well. Really, the only thing that hasn't been prepared in that case is that lingual cingulum. Now, we do like to keep natural tooth back there so that when the lower anterior teeth hit it, it's enamel against enamel. But there are concerns, of course, anytime we're going to be bonding something onto that deep dentin. And with the fact that we could place something like Emax crowns in place on those teeth, we know that that's not going to cause appreciable wear on those opposing lower anterior teeth. If we do crowns, it's also going to allow us to cement those crowns into place if you want to do that, or use a self-etching resin cement instead of having to do total etch or etch and rinse if you're going to do the Emax veneer. So if you're worried about postoperative sensitivity, or if the patient's had lingering postoperative sensitivity, leaning towards the option that allows you to cement might be a better choice. You may personally just feel that the crowns would be better, and if you put these 6 or 8, I'm not even sure how many there are, crowns into place, that's a better long-lasting restoration for the patient than veneers. And I would tend to agree with you there. A full crown that's cemented into place, we all have an idea about how long that's going to last, versus a veneer where there's still always the possibility of chipping on the incisal edge. So it really is kind of wide open based on what you're drawn more to. Is your decision going to be driven more by I don't want to prep anymore, or is it going to be driven more by I'd rather cement than bond it into place? Either way, it sounds like Emax is your restoration of choice, unless, of course, the patient has a couple broken PFMs in the posterior or shows a lot of wear on their natural teeth, and then I might consider Bruxer. If it was somebody who really had a severe bruxism habit or had broken previous restorations. But otherwise, I would go with Emax because of the aesthetics and the fact that it's strong enough to be cemented. And actually, even with veneers, I haven't seen any porcelain veneers chipped to date made out of Emax that I've put in place. And I certainly can't say that for a lot of the other veneer materials. Otherwise, I have nothing to say about it. But I really think it is one of those situations where you can't really make a wrong decision. You know, you could include the patient in the decision a little bit if you want to. But if they're like most patients, they just want something that's going to be aesthetic and long-lasting. Either one of those could, you know, float your boat. But a lot of times when I see a tooth where everything's been prepped but the cingulum, I'm probably going to go to a crown because I just feel they're more predictable over the long haul. So thank you for that question. That was a great one. And if we got 10 different dentists in here, we might get 10 different answers as well. There's no right or wrong answer. So thought-provoking, John. Thank you. What does he win for stimulating my brain and putting you to sleep?
Okay. Well, how about a clock?
A cupcake. Oh, that's mine. I'm sorry.
You can't give away a present. Re-gifting so soon?
I won't. Okay.
Okay. So we've got this clock.
Right, the
which
black
is
clock.
Amazing. And, I mean, beautiful decor. Mm-hmm. Then we have this photograph, which we will sign.
That's a different pose. I like that.
Yep.
I like that. You don't look pissed off at me for once, so that looks
Imagine
really nice.
that.
I haven't
rarely
offended you.
happens. So we'll
By the way, I was
sign
at a sexual harassment lecture yesterday for 2 hours. Just need to say I'm sorry. That's all.
Thank you.
All
I
right, you're very welcome.
It.
And I'm going to throw in a little gift of my own. That's right, John. You are now going to get a Bruxer adjustment and polishing kit. Why, you ask, when I just talked to you about Emax? Because the same blue stripe diamonds that have a mix of grits from 40 to 50 microns in size, the same diamonds that do very well on Bruxer for adjusting it, polishing it, and cutting it off for that matter, work very well on Emax as well. So it'll say Bruxer on the kit, but know that it works for all monolithics, including Emax. So that will be going out as well.
Present.
That's 3 things. That's pretty awesome.
It is.
You got any news for us?
I do.
Thank you.
A tech company has developed a new wireless MP3 player that allows a user to control the device using his or her teeth. Bite down once to skip tracks, twice to adjust the volume. There's a lock feature to avoid accidentally adjusting the device while chewing or eating. The device, known as Split, are individual 1-inch earbuds that are synchronized to play in unison through high-precision crystal clocks. It can hold about 24 songs at a time and has a 4-hour battery life.
Well, that's interesting. I pulled up a picture of these because I couldn't really picture what they look like. I like that they had to put them next to the dime, as though we're all familiar with what it's like to cram a dime in your ear.
Sure.
And go, oh, so it's a little smaller than that, so not quite as painful as that. And so I don't know that I understand how it works. Did the story say it was the sound of the teeth coming together or the vibration? Or?
I think it just monitors I'm not sure what it was.
But there's nothing that goes in your mouth.
There's nothing
like
in your mouth. It's just literally biting down.
Right. So you'd just be sitting there like on the subway and to change the songs.
Right. Which, wouldn't really be out of place in the subway because I'm sure a lot of that weirdness goes on.
Guarantee that the seats on either side of you would be left empty.
Perfect.
I would think that people would go, "Wow, what's wrong with that guy?"
Mm-hmm. Unless it catches on.
There's no strings. I mean, there's no with typical headphones.
Sure.
I like that aspect.
I do like that as well.
I'm intrigued.
I think it'd be really cool just for running and stuff. I hate having sometimes if I'm running on the treadmill, I'll accidentally hit my arm on the cord and
rip it out of your ears,
right.
or if you're listening to your iPhone, knock it off the treadmill.
Knock it off the treadmill. I've done that many times, but this would be really cool. I think because it's hands free, but I think it would be really hard to get used to the controls using my teeth.
I know. Look at her. She's got it in her ear. That doesn't look totally uncomfortable. It does look like from the front you'd be able to see a lot of it, but it doesn't look painful. It doesn't look nearly as painful as that ink she's got behind her ear. Can you imagine having a tattoo there? That's got to be one of the most painful
that would hurt.
Places.
Oh, gosh.
She must have gone into the tattoo artist and said, I'm looking for somewhere where I have very thin skin on top of a bone.
Right. How can you make this as painful as possible?
Right, exactly. And they said, well, there's only 2 things we can do. Put this tattoo back here and then make you wear one of these split things in your ear. That's the 2 most painful things we can come up with. Anything else?
Yes. We're always talking about new toothbrush prototypes on Chairside Live. In fact, just last week, we talked about one that claims to fully clean your teeth in 6 seconds. Well, here's another. A 13-year-old boy was diving with his father in Indonesia. They were watching schools of fish line up to have cleaner shrimp remove any parasites when the boy decided to get a dental cleaning as well. He opened his mouth when the shrimp were near and let them do their thing while his dad took photographs. Seriously?
Wow. Yeah, this sounds like a candidate for the Darwin Awards. You know how they do those awards every year for people who did something kind of dumb and are no longer with us?
Yes.
This sounds kind of like an IQ test. I'm surprised the dad didn't say, son, don't let these shrimp. I don't know if you, here's a cleaner shrimp. I had to look it up to see what it looks like.
Yep.
And this kind of makes sense because you can see the shrimp, the mouth of this fish is kind of large, although the teeth look like hanging down. They look like stalactites or stalagmites, whichever ones go down. And I guess the shrimp just goes in there and cleans between there, but I don't know. So he had it done here, but this is not like a long-term tooth cleaning strategy for him.
No. I think he was just down there, and actually they were 75 feet deep, and he had to hold his breath for around 40 seconds before the shrimp started cleaning his teeth. And the dad was saying that it's difficult for an adult to be able to do that and kind of dangerous.
Right.
But he was able to do it. But yeah, I mean, he's not going to keep diving down every 6 months to get his teeth cleaned.
His teeth cleaned, yeah. I don't think that it's that kind of level of cleaning that a hygienist can do. And I've never seen that, but we used to have a beagle. And one of my kids' favorite things to do was they would lay down on the kitchen floor and they'd pull up their shirts, and I would put peanut butter in their belly button. And then a cleaner dog, our beagle, would come lick the peanut butter out of their belly buttons.
That is
and every time they would have
disgusting.
friends over, they would say, can we play the peanut butter game? And their parents would watch in horror as they all laid down, and they were telling their friends, lay on the floor and pull up your top. And I was like, it's not what it sounds like. And so and then we'd put the peanut butter in their belly button, and the dog would lick peanut butter out of
that is so
their
strange.
friends' belly buttons as well. Well, I wanted to know more about these cleaner shrimp. I actually ordered some, and we let them onto the set on Chairside Live last week, as you may remember. And my teeth were so clean, all I needed was the last 3 hair follicles removed from my scalp, and my coffee cup was a little unclean. As you can see, it went right for your mouth, knowing what was going on in there. And you appear to have crushed these other 2 cleaner shrimp and are now using them for castanets. You're so cruel. And I thought you loved animals more than that. You are your grandfather's little girl, besides Parker.
That is so messed up.
That is cruel. We got to retell those stories one episode.
No.
That about wraps it up for this week's edition of Chairside Live. On behalf of myself, Megan, the CSL crew, and everybody here at the lab, I want to thank you for your time and your continued commitment to quality dentistry.
We'll see you next time. And happy birthday!
Thank you.
Happy birthday, birthday to you. I'll do it on my toes. Ready?
Mm-hmm. Like Michael Jackson.
But I do enjoy roasted butternut squash.